Let's be honest. Things usually start off great. The chemistry's strong, everything flows naturally. And then suddenly, out of nowhere, it's gone. You lose your firmness, and the whole moment turns awkward, frustrating, even a bit discouraging. If that sounds familiar, know this. It's far more common than you might think. And most importantly, it's something you can fix. Hi, I'm Dr. Hana Kim, a men's sexual health expert. Today, we're breaking down exactly why men lose their erection during intimacy, and more importantly, what you can start doing right now to rebuild confidence, stamina, and control. Stay with me until the end, because I'll be sharing powerful, science-backed methods to help you regain your performance and your confidence for good. How an erection actually works to fix a problem, you first need to understand it. And erections, believe it or not, are among the most fascinating physiological functions in the human body. It all begins with your parasympathetic nervous system. That's your body's rest and digest mode. When arousal starts, your brain sends signals through the pelvic nerves, releasing nitric oxide, the vital molecule that tells your arteries in the penis to relax and widen. Once those arteries expand, blood flows into two main chambers, called the corpora cavernosa, filling them much like balloons. At the same time, small valves in the veins close off, trapping the blood inside and creating that firm, sustained pressure necessary for an erection. But as we age, this process naturally becomes less efficient. Research shows nitric oxide production can decline by nearly 50% between the ages of 40 and 70. This means your arteries don't receive the same open-up signal they once did, resulting in weaker, slower, or more inconsistent erections. The good news? This can be improved. It's not permanent. With the right strategies, you can naturally boost nitric oxide, enhance blood flow, and restore healthy, natural performance. The 7 most common reasons men lose their erection. Let's look at what I most often see in my clinic, and what scientific research consistently confirms. Gravity working against you. This one surprises many men, but your position actually matters. Certain positions, like lying flat on your back, allow gravity to pull blood away from the penis, especially if you have any degree of venous leakage, meaning blood escapes too quickly. So, if you notice firmness fading more often in specific positions, it's not in your head, it's physics. Psychological factors. Erections begin in the mind, not the body. If your thoughts are racing, am I doing this right? Or what if it happens again? You're activating your sympathetic nervous system, the fight-or-flight mode, which directly interrupts the calm, relaxed state required for arousal. Studies show that up to 60% of erection issues have a psychological component, particularly in younger men. Reduced sensitivity with age. As time passes, the nerve endings in your penis can become less responsive, sometimes due to age, diabetes, or even minor injuries. Research indicates penile sensitivity may drop by as much as 30% between ages 40 and 70. With less sensation comes less stimulation, making it harder to stay firm even when aroused. Low mental arousal or engagement. In some cases, the challenge isn't physical at all, it's mental. You might be there in body but not in mind. Stress, depression, or simply lack of excitement can weaken the brain-to-body connection that drives arousal. Remember, true stimulation is both mental and physical. Performance anxiety. This one's huge. Once you lose your erection once, the fear of it happening again can cause it to repeat, a frustrating self-fulfilling loop. Performance anxiety is something I see constantly in men, and it's entirely understandable. Unfortunately, it activates the wrong nervous system response, the one built for survival, not for connection or pleasure. Poor cardiovascular health. Here's what most men don't realize. Your erection is one of the earliest indicators of heart health. Erections are all about healthy blood flow. So if you're dealing with high blood pressure, diabetes, or cholesterol issues, that same vascular damage also affects the arteries in your penis. In fact, Erectile difficulties can appear 3 to 5 years before any heart-related problems become noticeable. That means your body might already be sending you an early warning sign to start taking better care of your cardiovascular health. 7. Hormonal imbalance. And finally, testosterone. While it's not the only factor involved, it's definitely a key player. Testosterone supports libido, nerve sensitivity, and even the flexibility of your blood vessels. After the age of 30, testosterone levels naturally decline by about 1% each year, and over time, that small drop adds up. So, what can you do starting now? Let's go over a few practical, science-backed solutions. Number 1. Empty your bladder first. A full bladder presses against the pelvic nerves and can interfere with the signals that help you maintain firmness. It sounds simple, but it's surprisingly effective. Number 2. Use gravity to your advantage. Choose positions where gravity helps blood flow into the penis rather than pulling it away. Standing or kneeling positions often make a noticeable difference in maintaining circulation. Number 3. Prioritize foreplay. When your partner is more aroused, you'll naturally receive stronger stimulation. Foreplay isn't just for her, it benefits you too. Arousal is a shared exchange of energy, and when both partners are fully engaged, your body responds more powerfully and for longer. Number 4. Avoid alcohol. Alcohol slows your nervous system, decreases blood flow, and dehydrates you, all of which can weaken your erection. Even moderate drinking can lower erection quality by roughly 25%, according to research. Number 5. Space out ejaculation. Your body needs time to rebuild neurotransmitters and hormones. Giving yourself a break, even 7 to 10 days between sessions, can help restore sensitivity, energy, and endurance. Number 6. Improve circulation and nitric oxide levels. Support your blood vessels naturally with ingredients like L-arginine, pomegranate extract, and pine bark extract, all backed by research for enhancing nitric oxide and vascular function. But remember, supplements only work when combined with a healthy lifestyle. Exercise, quality sleep, hydration, and proper nutrition are equally crucial. Number 7. Address sensitivity issues. Focus on improving your nerve health. Keep testosterone levels balanced, boost blood flow, and engage in regular stimulation to maintain responsiveness. Even gentle vibration therapy has been shown to increase nitric oxide levels and support better nerve function. When it comes to health, most men focus on just one thing: fixing what's broken. We wait until energy crashes, drive fades, or sleep becomes difficult, and only then do we start searching for a quick fix. But here's the reality. Real strength doesn't come from chasing pills or shortcuts. It comes from balance. It's about giving your body what it's been quietly asking for all along. That single vitamin you take before bed isn't magic. It's a signal. A sign that you've finally started listening to your body. It's the beginning of something greater, restoring your natural rhythm, recharging your masculine energy, and remembering what it feels like to truly rest. Because in the end, health isn't about age, it's about momentum. It's the daily decision to take care of yourself just a little better tonight than you did yesterday. And when you wake up feeling stronger, calmer, and more alive, you'll realize the bigger picture was never just about one supplement. It's about reclaiming you. Remember this: every man faces challenges. But the difference between those who recover and those who remain stuck lies in one thing: the willingness to take action. Your health is worth it. Your confidence is worth it. And your happiness is worth it. Take care of yourself, because when you do, everything else in your life starts performing better too. I'm Dr. Hana Kim, and I'll see you in the next video.